Hi everyone, I am Yixuan from the Music Lab, Johns Hopkins University, and I'm glad to present you our work, Multispectral Photoacoustic Imaging of Aggressive Prostate Cancer in Vivo, using PAMM dendrimer conjugated agent. Prostate cancer is the second most malignancy for male worldwide in 2018. It is also estimated as the first leading site of new cancer cases, which takes around 21% of all sites, and the second leading site of death, which takes around 1/10 of all sites for male in the US 2020. In addition, in the past 4 decades, the prostate cancer rates kept increasing in most of the countries. To increase cure of aggressive prostate cancer, early detection and selection of optimal treatment are essential. Current techniques for active surveillance of prostate cancer include prostate-specific antigen, the PSA test, and serial prostate biopsies. However, the PSA test is limited in accuracy, which has up to 75% false positive rate. Another popular technique, the transrectal ultrasound biopsy, known as TRUS biopsy, is also limited in sensitivity and specificity and may introduce side effects such as pain, bleeding, and infection. These limitations usually lead to unnecessary aggressive chemo or radiation therapies to patients who are not actually under risks, which also waste medical resources. Therefore, there is an urgent need for less invasive and more accurate aggressive prostate cancer detection. In this work, we leverage molecular and functional imaging of prostate-specific membrane antigen, abbreviated as PSMA, to provide another layer of precision in the detection, treatment planning, and therapeutic monitoring. We employed multispectral photoacoustic imaging as the imaging modality and developed PSMA-targeted contrast agent to enhance the image contrast. The prostate-specific membrane antigen, shortened as PSMA, is an enzyme encoded by the vivo-LH1 gene. It is also a biomarker for imaging and therapy for not only prostate cancer, but also several other cancers. It is highly expressed in normal prostate cells and overexpressed in prostate cancer cells. The most important property of PSMA is the proportional relation between its expression and the aggressiveness of prostate cancer. Numerous studies have investigated molecular and functional imaging of PSMA using different modalities. To illustrate, there have been works using MRI and optical imaging on mice models, and nuclear imaging such as SPECT for patients. In our investigation, we selected multispectral photoacoustic imaging for prostate cancer detection. There are a lot of merits of cross-sectional photoacoustic imaging. Specifically, it provides molecular contrast of optical imaging and similar imaging depth as ultrasound imaging. More importantly, it is non-radiative and can be non-invasive or minimally invasive. Generally, photoacoustic effect converts optical energy to mechanical energy. It is the formation of sound waves following light absorption, which can be concluded by the equation P0 equals gamma by mu by F, where P0 is the initial pressure, gamma is the Bruneian parameter, mu is the optical absorbance of the tissue, and F is the optical fluence. The optical absorbance is associated with the absorbance coefficient and the concentration C, and it is different in different tissue types. To illustrate with our application, as shown in the figure on the right, the PSMA targeted agent, oxyhemoglobin and deoxyhemoglobin, have different absorbance spectrums. Therefore, we can use this information to quantitatively differentiate the unknown concentration of each tissue type if we know their optical absorbance coefficients. Another important arm to enable photoacoustic imaging of prostate cancer is the PSMA targeted contrast agent. The contrast agent is equipped with a PSMA binding ligand to link to the PSMA. So if there is overexpression of PSMA, there will also be strong photoacoustic contrast given by the linked conjugate. In our first generation invention, we developed a dual contrast agent named YC27 for both optical imaging and photoacoustic imaging. In addition to the detection purpose, in the second generation, we took the advantage of PAMM dendrimer to make the agent multifunctional. Potentially, by leveraging the multiple arms given by the PAMM dendrimer, we can integrate more imaging dyes for further contrast enhancement and contrast agents for different modalities and even other chemicals for theragnostic purposes. Overall, in the clinical setup for active surveillance, the patient will intake the contrast agent, then a volume of multispectral photoacoustic images with each frame acquired at a different wavelength will be recorded, on top of which we will implement the spectral decomposition, or also known as spectral unmixing, to get a map of deoxyhemoglobin, a map of oxyhemoglobin, and a map of the contrast agent. The map of the contrast agent will provide us information on the aggressiveness of prostate cancer. The in vivo validation of this work was conducted on 5 intact male mice. 2 different tumor models were inoculated subcutaneously, where the PSMA positive PC3 PIP, giving high PSMA expression, was inoculated on the right lower back, and the PSMA negative PC3 PIP flu, which is an artificial tumor giving low PSMA expression, was inoculated on the left lower back. Exclusive photoacoustic contrast was only expected from the PIP tumor, but not the flu tumor. As for the imaging contrast, we developed 3 different conjugates with different number of imaging dyes per dendrimer. As indicated in the table, conjugate 1, 6, and 6C have 1, 6, and 6 dyes per dendrimer, respectively, where especially conjugate 6C is PSMA untargeted and is the control group to conjugate 6. Both fluorescence imaging and photoacoustic imaging were conducted before injection at 0 hour and after injection at 24, 48, and 72 hours. Where the photoacoustic imaging system is a popular configuration in research community consisting of a Verisonics ultrasound research platform and an Nd:YAG pulsed laser. Multispectral cross-sectional photoacoustic imaging indicated promising results for conjugate 1 and conjugate 6. Representative images in vivo are shown on the left, where the first row presents ultrasound images demonstrating the anatomy in axial plane, and the rest are image fusion of ultrasound image and decomposed contrast agent photoacoustic map at 0 hour, 24, 48, and 72 hours. Flu tumor and PIP tumor were consistently imaged on the left and right respectively. At 0 hour pre-injection, there was no dye detected. At post-injection phases, for conjugate 1 and 6, apparent uptake was detected in the PIP tumor, but not in the flu tumor. For conjugate 6C, since it is not PSMA targeted, no obvious uptake was observed in either PIP or flu. In addition to visual assessment, we also quantitatively analyzed the contrast of PIP versus flu by calculating the ratio of the mean intensity within the region of interests of 2 tumors. It reveals that there was up to 11-fold contrast enhancement given by conjugate 6 and up to 4-fold contrast enhancement given by conjugate 1. The strongest contrast for both conjugates was observed at 24-hour post-injection phase. We conducted fluorescence imaging to show the dual modality capability and further confirm the tumor uptake. In agreement with photoacoustic imaging, fluorescence imaging clearly showed that the PSMA positive PC3 PIP tumor had significant uptake of the conjugates, whereas the PSMA negative PC3 flu tumor did not. Particularly, conjugate 6 showed obvious higher contrast than conjugate 1 by visual assessment. The conjugates were gradually washed out from 24-hour to 72-hour after injection. We also bisect the tumors and imaged them ex vivo at the end of the study to better validate the conjugate uptake. From the results, it clearly reveals that the PIP tumor had much more remarkable uptake than the flu tumor. In conclusion, in this work, we leveraged multispectral photoacoustic imaging to provide molecular and functional imaging of prostate cancer. We developed new PSMA-targeted contrast agents using PAMM dendrimer. In vivo studies suggested that conjugate 6 expresses the most remarkable contrast of PSMA-positive PC3 PIP versus PSMA-negative PC3 flu. In future work, we will keep working on the multifunction of the conjugate to enable theragnostic functions. And thank you for your attention.